everyone, this is Dr. Brenda Mondragon. Welcome back to my channel. Before we get started, go ahead and click subscribe. Hit the bell for notifications so that you never have to miss any of my new and upcoming videos. And away we go.
Yeah, like the back scraping. I saw that and I was like, I align with her.
Okay. So you haven't had scraping? You haven't had... Okay.
Nope.
No chiropractic, but so you've never even been in a chiropractor's office?
No.
No. Have you been to like a physical therapist? For your hip or anything?
Probably like back in the day, but I can't recall any adjustments or anything.
Nobody ever manipulated you or made anything go pop in your back or...
Not that I can recall.
Okay. When did this hip problem begin on the left-hand side?
The hip on the left-hand side? Probably the beginning of the year, whenever I started to get more active again. I think it's just from squatting and doing lunges and all of that kind of stuff. I don't know if I went into it too quick and didn't stretch out properly or any of that, but it's just been, it's not super painful, unbearable, but it's just it's there,
Well, how quickly did you recover from the right hip injury?
Oh, I was out for 6 to 8 months. Yeah.
Oh, really?
I was on crutches for 3 months, and then I had to take it easy for 3 to 4 months, and then I was back at it again.
Do you still play soccer?
Mm-hmm.
Do you notice that this hip or any of the hips bother you during soccer practice?
Not so much.
It's just mostly at the gym when you're squatting then?
Yeah.
When you get up in the morning, do you notice it?
I can't, no.
Okay.
Not so much.
I'm just wondering how severe it is.
Yeah.
So if you're saying, it hurts all the time, every moment, if it hurts when I walk across the room.
No, it's not
Do you understand? That's a worse problem. Okay, so I'm okay, maybe this is structural, maybe this is muscular. Okay, anything in your neck?
Neck, yeah. I mean, I would say it's just the normal, always find myself adjusting it myself because it's just stiff.
Okay.
And then, like I said, my shoulder blades, I always have the need to feel I can squeeze my shoulder blades and crack it, but it just feels there's something else. It needs more.
So
I would say every hour I just find myself having to stretch my shoulder blades back, and I'm always opening up just because it's just so sore. It's tight.
So how often are you going to the gym?
5 times
5
a week,
days a week?
On average.
Okay. My goal is just to get things that are stuck moving for you.
Sounds good. Okay,
that's it. That's really all, and then I can do. Well, your job, after this, is to let the parts that move too much heal. Because sometimes where you're feeling pain is irritated because of over movement, excessive movement.
That's quite possible.
Okay, not always. Sometimes it's stuck and it's inflamed. But usually the irritated parts are the parts that are moving around too much. Usually. Depends on which area we're talking about. Alright, so I'm going to, if anything is overly sensitive, you just tell me. C1 and C2. Whoa, you really pop your neck, don't you?
Yeah, because
it's always... that way and you pop it.
Yeah, because it's always stiff.
Yeah, but you got to go this way. Yeah, that's really hard to do to yourself. To pop that way. Okay, when I adjust it, I'm going to be going that way into it. C1 and C2 are really shifted posterior and to upwards like this.
Yeah, I feel I get stuck right there. I mean, I could probably, that's probably as far as I could go.
Well, I think you pop it and then you get it to go, right?
Yeah.
Is that what you do?
I don't know, honestly.
Okay. You see, this is really moved out to that side. Okay, let me check your posture really quickly, okay? 80% of the population just take a walk down to the edge of the carpet. So, right off the bat, I'm noticing that with that left foot, you are turned this way. Yeah, your left foot is inverted. And you are riding high on this left side. Okay.
Okay.
I'm going to look for over-contracture here. So here we go, just a warm-up, okay? If it's too much, I'll back off.
Like I said, go for it. I just want to be fixed.
All right, here we go. Okay, yeah, there's a knot there. breathe. There you go. That's it. That's it. There you go. Okay, here we go. This is what I wanted to work on when I first started. It's going to take me a little bit to get that one. Okay, let's try the other side, Linnea. We'll find out what's over here. Oh, hello. You have good posture, though.
That's a relief.
Yeah, I just got to figure out what's going on with your mid-back and why you're hurting so bad. Nice flexibility. Let's see, yeah, I feel the muscles twitching. Yep. Okay. All right, you ready for the pops?
All right.
We'll see what goes. You feel very loose.
Like I stretch all the time, and like it just feels like
You need more.
Yeah, like I'm not doing something right, or
I have a feeling it's posture. You're very flexible. Now, I haven't evaluated the rest of you, but your neck is super flexible. If you're looking down all day, for example, on your phone or whatever, not looking at the horizon like we're meant to be looking, you're going to have neck pain.
Gotcha.
Okay, here we go. Right side first. This is the bad one here. Oh, good. You're good. Nice. How was it for your first adjustment? Not bad.
No.
You okay?
It's a weird feeling.
Well, how was it?
Good.
You okay?
Yeah. It's just a different feeling, because doing it from like yourself to like I don't know.
Okay.
It's good.
Okay.
It's good though.
Okay. I don't want to scare you.
No.
Are you? You're
No,
still
you're
here
good.
with us.
Yeah,
You're
no.
still here. Okay, here we go. There's one. Very good. Right here. Okay, I want to see if I can get this one. If not, it's no big deal. Right here. No. We'll try it at the end. Okay. Yeah, that right side unlocked. That's good. Okay, back. We're going to go back, chin back. There you go. This is what I'm going to do. Okay, I'm going to drag the fascia. Yep. And now we're going to tuck that under. There you go. You okay?
Mm-hmm.
Oh, I gotta like place it like this though. Is that okay?
Mm-hmm.
It really wants to wing out to the right. Your bum keeps trying to go over here to the right. Like, no. Go back that way. So yeah, this is the kind of stretch that you need to be doing. Yeah.
How would
I do that?
Yeah. I could probably put a little crossball there.
You just need to be bent backwards. Soup can. Have to cut that part out. Okay. All right, I'm going to leave you like that for a second. I think. But I'm like, wait, what's this over here? There you go. This left side really briefly. Okay, good. Just stay like that. We're going to do the feet, okay?
All right.
Good job. There it goes. That's good. Ankle, okay, ankle. knee. Very flexible. Reach overhead and grab the table for me. My hip socket, okay? Let me know if does this hurt at all, what I'm doing here. That was the hip.
Yeah.
Does that feel okay?
Yeah.
Okay. Good. Now we do hip. This one has more scar tissue.
Yeah. Well, I can feel it. I can feel it a little bit on my lower back.
Does it hurt your lower back?
It doesn't hurt, but I can feel more of a tug than in my hip.
Okay, okay. But this shouldn't hurt you.
No,
but
it
it might
doesn't hurt at
feel
all.
weird.
Yeah.
That is your hip right there. There it goes. Very good. Would you say that this is where you're feeling it? A little higher, a little lower?
Yeah, I would say like a little bit higher. Like right in there.
Right here? Okay.
Yeah, like right there.
Do you mind if I take the shirt off?
No.
I can't see.
Yeah, it's like... Yeah, more towards... Like right in here, I would say.
I feel... Okay, so hands back on the pads for me.
Yeah.
Yeah, now I can see. Here we go. Look at that, though. I feel this, too. But you know what? I feel like 80% of the population has this. The same side-to-side subluxation that you do. So take a deep breath in. And all the way out. Let it all out. There you go. Switch to the other side. Deep breath in. And out. Perfect. And again. That one was resistant. It went in, but it didn't want me to do it. Deep breath in again. And let all the air out. Good. When you feel the soreness in your back, is it on the right side or the left?
It's more like center. It's like both almost.
Okay. Okay. How is this?
Good.
Okay. Can I go a little harder, or you?
Go for it.
Okay. I have to ask.
Yeah,
I didn't.
Of course. Oh, she's breaking my back.
She's breaking my back. No. Here we go. Right there is pretty bad.
Yeah, I can feel that.
Okay.
Wow,
Okay.
that's good.
Okay. Here we go. I'm gonna push these down. These need to go south. Your ribs are all subluxated or misaligned up high. We need to push them down. Good. I just say most people can't take this. I'm like, haha.
Makes your life easier. But...
Well,
no?
I can just get through it faster. When somebody can't take this, then I'm kind of like stuck. I can only go so far. There you go. Just keep breathing. You got it. Hands on the carpet for me. Let's see if I can't get in between there. Yeah, there you go. That's it. I'm just going to stay right here. I'm going to push. Next one down. And I'm going to push again. Breathe. just so I don't tear your skin. So I can glide.
Is that like scar tissue?
The tissue's on the surface.
Oh, gotcha.
See, without the oil, I can't feel too well.
Gotcha.
I can feel the deeper structures, the big, the big blocky structures, but the fine details.
Yeah.
I need the oil. That's it. Yeah, his upper traps. I mean, this is all from weightlifting and stuff like that. There you go. There you go, just keep breathing. With my elbow. I know, hi. I'm just going to put pressure then. How about that? Yeah, there you go. That's it. Breathe as much as you can. Great, other side. A little higher on this side. Oh, hi. Where are you? There it is. Yeah. I get it right on it. Got it. There we go. That's it. I wait for it to give up. There you go. It's almost there. I'm going to give it a little break. It's resisting a little bit. That's okay. It's okay. You're all right. I'm gonna try it again, okay? All right. Here we go. And exhale. Let all the air out. That's it. That's it. That's it. There you go. Oh, whoo. I got it. I got it. I got it. There it goes. So you were right. It's high, but like much higher. Okay. Okay. Woo.
Yep, you found it.
Take a break. Take a break. Do a little. I'll work you back into it again. Okay. There's several down here.
All right.
You have to loosen up the entire structure. You can't just go here.
Okay.
You got to do all of the surrounding stuff too. Or it won't let go. It's always important to listen to your patient because where they point is usually the culprit, but then you have to backtrack and figure out where's it coming from. And here's a bad one right here. Wow. Okay. Breathe. Okay. this arm above your head again. Ooh, that one doesn't go up too well. Okay. Yeah, I didn't see this one until the breeze just now. Are you okay? Is this too much?
Yeah, no, it's perfect. It's just right where it needs to be.
Oh God, look at all that. Hello. Goodbye. Say goodbye. There you go. That's it. Very good. Okay. Arm down. Breathe. Take a couple breaths. Here we go. I'm going to count backwards from 5. It's very intense. I'm going to break down this knot.
Right.
Yeah, I know. Fun times, good times.
Go for it.
Here we go. Right here. Oh God, it's really bad. 5, 4, 3, 2, 1. Breathe. Next one down. 5, 4, 3, 2, 1. That's it. There it goes. Whew. All right. Pretty clean back here. Very good. Other arm behind you. Be careful of the bars. A little bit more over here. Very good. Arm down. Uh-oh, I found one up here.
Yeah.
Ooh, look at that.
Yeah.
Okay, I'm sorry.
No, go for it.
Tuck
Get
your
in
chin.
there.
Tuck your chin. Tuck your chin.
Tuck it.
I'll get it. There it goes. All right. Let's see how much it's got left. It's coming out. It's getting smoother. There. I think we've got it. One more. Yeah, you're good. Okay. Take a break. We're going to go to a different region. There we go. So when I bend your hip like that, your knee, does this hurt?
No.
Does this hurt?
No.
When I go into the hip socket like that?
No.
And how about if I take you out like this?
Yeah, I feel a lot
that,
better
you feel it?
resistance. Yeah.
Okay.
Right there.
I got it. I know. Gluteus medius and minimus is not happy with you. And part of your TFL. So, your hip stabilizers. They're just kind of like, no. They're a little bit taxed. It's okay. It'll be all right. See, this is what I meant by the QL. Up into the low back here. There you go. Okay, back to this again. Just seeing if I got it all, okay? At least for one day. Yeah, you're doing good. The only other thing I could do is maybe before I do the scraping is your legs.
Alright.
The legs are going to be tender
Oh, yeah.
on your legs.
That's okay.
If you want to come up on your elbows, you can.
No, alright.
I mean, you know.
Oh, like this? Or you mean like this?
Yeah, like if you want to relax, however you want to do. You know, if you don't feel like you have to be plastered in there, if your I know the sinuses start draining and everything. But I got to feel what's going on here. If it makes you feel any better, go watch the video of my brother beating me up with this thing. You can go find that video. I think I published it back in May. And I'm like screaming. No, I wasn't screaming. I was just wincing. I was whinging, like they say in England.
Everything's fine.
Everything's fine. It's fine. Oh no, not the hamstring. Ah. There you go. Calves. Lovely. Oh, you got a nice knot there. Sorry. I'm just gonna get it. So that feels pretty good. Oh, I gotta get on the TFL. I know it. Sciatic nerve is right here. Okay. Okay. I'll give you a little break before I do the leg. The leg is going to be pretty painful if you let me. I mean, you can always just say no.
No, go for it, leg.
How are you feeling so far?
So much better.
Oh, really?
Yeah.
Okay.
Like,
Let's do it again.
because like it's just I just always feel like super sore. It's like a good kind of like sore. Like I know.
Oh,
Like,
well, you've got a really nasty knot right here on you, okay?
yeah.
And then you got
I could
a few
feel
up here,
it.
and then say I know.
it's oh.
Does this hurt too bad?
Not there, but a little bit like
Like
lower.
right here?
Yeah, like right in there.
Right here, that's where it's hurting a little bit. I'm
yeah,
sorry.
right there.
Does it hurt too much?
No, it's like.
Like I need to get it?
Yeah.
Okay. I'm gonna go out into the ribs really easy here. This is hurting too much, you okay?
No, that's good.
Oh, see? There. That's what I see. This is what I felt. I was trying to break that one down. You can almost hear it. Like, come on, Mike, pick it up. Arm above your head for me, and then I'm going to have you lift your head up, and you're going to hang yourself a little bit off the table like that, and just relax as much as you can. Relax. I got you. I got you. That's it. Oh, I'll be easy. I'll be easy. Okay, up into here. Yeah, what is all this? Oh, it's just from lifting weights. You need a lot of work. So does pretty much everybody that comes in here, so you're not alone. We'll give you a first go of it here. Woo! Hello, posterior delt. Okay, relax back down. Come on and sit up for me. Face the windows over there. You're gonna be back here with me. It's like getting a deep itch, you know, deep in there. Now these bruises can be a little sensitive the next day. Arnica, if you've got it, that helps.
Arnica.
It's an astringent.
Like Epsom salt?
Yeah, you can do that too.
Okay.
Do it all.
Yeah, like I try and work on myself as much as I can, but it's like I said, like I don't know if I'm just like.
Well,
like,
I gotta really check out that left hip. I'm wondering what's happening there with that left hip. Feels like you are working on it, but the pain might be coming from your low back. Sorry, I'm getting all different angles, so I'm moving your head
no
around
worries.
so I can get in there.
Go for it.
Yeah, there you go. So the left side actually ended up being more congested. Yeah, see, that was that lump that we found before. And look back for me a little bit, shorten it, and I can get down in there. There we go. Okay, arm across your chest.
Just one?
Just one.
Okay.
I did it to this shoulder. I gotta at least check it. Cool. Hip like don't want to go. Hold on. Let me carve it out. There we go. That's it. There it goes.
Mm-hmm.
You have it on the other side too. It's just using your arms. Okay. Mostly it's left-hand side up here, and then like a little bit on the right.
Oh man. Yeah, it definitely is my left hand side though. But that's where I feel most of the
Is it?
stiffness too. Like up here. So that, I mean it would make sense.
That's what I'm gonna do. Yep, now you're gonna go back, head back off the table. That's it. And we're gonna go a little deeper. That's it. That's all it's got. Stay there. There you go. There it goes. All right. You have some serious hip flexors.
Is that a good thing or bad?
I don't know. I feel that. Whoa. Now, this is what I'm talking about. Here you don't have much.
Mm-hmm.
See how this is all bone? And then, bam, you got a huge piece of muscle.
Mm-hmm.
You've got to work on these.
Okay.
You have it on the other side.
So what am I working
That's your
out right here?
gluteus. Those are your abductors. Also your
Okay.
hip stabilizers. They rotate your hip this way.
Okay.
They rotate the torso when you're standing clockwise, okay, on the left. But then they abduct as well.
Okay.
So you've got to work on
the
those.
abductors. Okay.
Golf puts a lot of torque on the lower extremities and the lower back. There you go. All right, on your stomach. Okay. Do this knee. Perfect. Let's just loosen you up here a little bit. Good. All right, now on your side facing me over here. So here we go. And head goes back again. Ooh, man. Go back, go back. Look at how flexible you are. That's it. That's all it's got. Stay there for me. It sits underneath the gluteus maximus. Okay, but the gluteus maximus is mostly a just extensor. Yes. So this is what you need to work on.
All right.
You're looking at the back of the spine here.
Okay.
Yeah, see how you have this all here? It's all nice and developed.
Mm-hmm.
The other side's very, very thin.
Yeah.
Almost like I said, atrophied, like it's been cut from its nerve supply. But you don't have pain, right?
Not
So I don't think so. And you have strength.
I don't know. I'm just trying to figure out
Can you feel that?
Yeah, I can feel
Now
it.
feel your other side. Can you tell that the head back, you're not going to be able to feel it with your head forward?
Oh yeah. That's wild.
Okay, so
I don't
when I'm
understand.
analyzing your hip, okay,
Yeah.
it's just like very apparent that it's underdeveloped there. So if you're swinging your leg, it's just tearing. It feels like the little fibers are just tearing in there. So I can work on it all day long, but I'm just beating it to a pulp. It actually needs to be strengthened. Yeah. Like leave it alone a little bit. Like don't
Okay.
work on it too hard.
Okay.
You can stretch it. Stretch it. Fine. You're stretching it right here.
Okay.
Okay, this is contracting. You don't want to contract. You want to stretch or. Okay. Stretch. I'm hyper flexible.
I was gonna say I'm not that flexible.
Yes, now heel out towards here.
Heel.
Move your leg up. Yep, and is that as far as you go? It might be. It might be. I mean, you're a guy. I mean, I'm.
That's about as far as
it's called testosterone. It just tightens everything up. Now, can you feel it though here?
Yeah. Right here.
So when you're building that muscle, you need to also stretch it.
Okay.
Because you don't want it to become non-functional. You want to build it through its full range of motion.
Okay.
You don't want to build it and it be contracted and then only have this range of motion. You want it to have its full range of motion. So when you're done working it out, stretch it like that. Okay. Don't do the stretch ahead of time. Do it afterwards.
Do it after.
Yes.
Got it.
Afterwards. Okay.
All right.
And then elbow back and towards mine. Perfect. Look straight ahead for me. Then elbow back. Good. Anyway. Just giving you some range of motion. Good. Relax. Lean away. Lean away, your whole body away from me. Okay. So we're gonna go. You're gonna have a seat on the floor, face the table. Back towards me. All these instructions. Yeah, you're really curved here. Yep. Give me your arms. Go all the way back. Right to there, right there. Not in your low back, just your mid back. Right there. I really want you on that scar. Where are we? Yeah, right there. You gotta really just lay on that scar right here. But I just want you to stay. Just stay. Don't, if you can't take it, then we'll come off of it. Roll your arms down. It's easier with the arms down. Arms up here together, and then you're gonna roll. I'm just gonna do it for you. Go. That's it. Yeah. Roll off. That's what this thing is. Okay. It's mostly that I want something narrow enough to get between your wings, because you gotta really flex. That's the part that nobody can get, and you gotta extend. And this is not as much leverage as the weight of your arms going back. Mm-hmm. Okay, so this is easy. This is harder. If you work in construction, I bet you know, right? Yeah. All the levies and everything that you guys do. You gotta be back. So you're trying to bend back your backwards over the roller. Yeah. And then so when you come out of it, you're straighter. Look straight ahead for me, but like how does this feel in here?
I mean, a little bit sore, but it feels good. I feel
looser?
Feel light, yeah.
Okay, remember how you were saying you're feeling imbalanced? Just walk. How does it feel just to walk? I mean, when you're warming up, I want your shoulders swinging. My son is the same way. He doesn't swing his arms. When you walk, you're supposed to swing your arms. Do you even swing your arm when you walk? Yes, you have to.
Maybe.
That's from infancy. We learned how to do that when we're tiny.
I mean, I think I move them slightly, but
so you see how it's opposite leg, opposite arm.
Opposite leg, opposite arm. Yeah.
Now I'm thinking about it. Yes. No. But that's what you got to do. You almost have to learn how to crawl again. And, it can't be same arm. It's cross crawl, okay? And you got to get your shoulders up. You got to get your head back. You got to practice loosening up your rib cage. If I could teach you anything, it's just to loosen up your rib cage.
Okay, so
keep your ribs moving.
Yeah.
I just want you to focus on that exercise. Okay, that foam roller.
I can do it.
All right. What did y'all think of the video? Were there enough cracks in there for you? Let me know in the comments below. Until next time, everyone, take care.